Good afternoon. Good afternoon. Good afternoon. Wow.
Yeah.
Isn't it Friday?
It's Friday.
Oh yeah.
Thank God
Hallelujah.
it's Friday, right?
Yeah.
I always say that. Thank God it's Friday.
Yes.
Because when Friday comes, you know what that is.
Go ahead and
It's
tell
time
them.
for another episode of the CareSouth Carolina Community Live Podcast.
What? What?
And we've taken a little hiatus the last couple of weeks and very, very much needed rest and some more education to uh, about what we're going to talk to you a day on this show about today. We got some very, very special guests with us today. Uh, this is the first time we've had the opportunity to have these two dynamic ladies on at the same time.
Yes. We special. We are
Right. So I'm excited about today's discussion. I am really excited about today's discussion. We're going to hear a little bit about the vaccination rates here in the state. We're going to talk vaccines. We're going to talk boosters. We're going to talk post town hall. When I say post town hall, you're going to hear what I'm talking about here in just a few minutes. But without further ado, I'm going to turn this over to one of our guests, Ms. Ann Lewis. She's been here quite a few times. She's our CEO at CareSouth Carolina, and it's always wonderful having her here. So we're going to give her the floor and let her do what she do.
That's
All
right.
right. All right. This is so much fun. I really enjoy this. And let me tell you, I'm really impressed by your intro. Really
Yeah.
good job. It was like, wow, aren't we getting professional? So I'm outside. I'm sitting on my porch trying to get a little bit of fall air. And basically, all I'm getting is fall humidity. So if there's some strange noise in the background, you know, let me just go ahead and warn you. But happy Halloween month. Folks at CareSouth know this is one of my favorite months. I wish I had my headband on with my Halloween gear on it, but we have a lot of fun at CareSouth for Halloween. So let me just talk a little bit about what Moret sort of teed up. A few weeks ago on October the 28th, Thursday, we had a town hall. So let me tell you what that is. Prior to COVID, we used to have at CareSouth 3 staff meetings a year. Now, that's a pretty big deal for us because we've got well, in the past, we had anywhere from 500 to 550 staff, but they were all scattered all over the PD. We have offices stretching all the way from Bishopville all the way up to Dillon County. So that was a real Herculean task. But we would shut down for an entire day, bring everybody to the Florence Darlington Tech SIMT building and get together, catch up on everything, kind of reconnect ourselves, network a little bit, get some of the latest and greatest information, and just generally come back together. Well, we hadn't done that. We hadn't done that since March 2020.
Mhm.
So we've missed a lot of connectivity. We've missed a lot of opportunity to share information and to really catch up on things. So then we started thinking about what was ahead for us in the realm of COVID and vaccination. Many folks may know that CMS recently talked about it's going to be implementing a rule that healthcare providers who accept Medicare and Medicaid payments, which of course that's a big part of who CareSouth Carolina is, providing care to the Medicare and the Medicaid patients. Unless their staff are fully vaccinated, those payments are going to go. Now, that ain't good. So we started thinking ahead. CMS hasn't given any definitive date when that would take place, but at CareSouth, we kind of want to be prepared. The board of directors of CareSouth has really been concerned. Our board of directors, you may not know, but they represent the community. They are actually, every one of them, all 12 members of the board, are patients. And I am excited to also say all 12 members of the board are also vaccinated. And many of them have been vaccinated since they were eligible to be vaccinated. So they have been very, very concerned about the vaccination status of the employees at CareSouth. And it's a sort of a controversial thing. We don't want to lose staff, but at the same time, it is so important, as OSHA continually reminds us, to protect our staff and our patients.
That's right.
And vaccination is the pathway to that. So, knowing these things, we were very adamant about giving the staff every opportunity they could possibly have to get questions answered, to get knowledge, to dispel myths, to hear true evidence-based facts. And folks, let me tell you, there isn't anybody better in the state, and I'm not so sure, it might be the whole region, equipped to do this than Dr. Jane Kelly. She agreed to do our town hall. We had some questions posed beforehand, but there were also a lot of live questions, and it really made a difference. So I'm going to introduce this very special lady. I have never met Dr. Kelly in person, but I swear I think I know her. It's someday we'll actually be able to meet in person. But Dr. Kelly is a board certified internal medicine physician. She's had more than 36 years experience in public health and in clinical practices. She's had a wide range of that experience. She's worked in international settings, domestic settings, other FQHC. She's not foreign to it. She actually was down at our Charleston sister FQHC, Franklin C. Fetter, near and dear to my heart. She's worked in the Indian Health Service. I am very tuned in with the Indian Health Service. I did some work with them, and that means quite a bit. I know the things that they are challenged with. Also, CDC, Emory, she's had experience, and the Georgia Public Health Department. Currently, she's DHEC's assistant epidemiologist, and in my humble opinion, one of the most knowledgeable folks that we have in the area of COVID. So let me introduce Dr. Kelly.
Oh my gosh, that's an embarrassing introduction. You're very kind. Thank you. Sometimes when people ask me what I'm charged with doing, what do I do for work? And it's like I read as fast as I can and try and translate it to people, because I feel like that's the biggest thing we can do right now, is to help people get the information that they need so they can make informed decisions. So I know we've got so many different things to talk about. I don't know where to begin. Where do you all want to begin?
Let's begin with the current situation in the state of South Carolina. We've been up and down, and, folks get a little like, where are we now? Are we up? Are we down? What can we do? What can't we do? All of that.
Sure. I'm cautiously optimistic that we're starting to have a downturn, but I also know the holidays are coming up. So if you look back at, history over the past year and a half, South Carolina was actually kind of protected for a while. Think about the spring of 2020, the early days when things were just exploding in the Northeast and exploding in other states. We were pretty quiet for a while until after July of 2020. And I think some of that is directly linked to 4th of July holidays, people getting together, schools out, summer vacations. And we hadn't at that time really appreciated how important it was for wearing masks, keeping distances. So there was definitely a surge in July of 2020, and then started to decrease. Again, there were other states that were really in trouble, but we were kind of staying on the lower side of new cases until the winter really hit. Winter holidays, we had a big surge January. Fortunately, that's also when we started having vaccine available. And starting in February, we just had a steady decrease in the number of new cases because of vaccine, because of people being careful, because of wearing masks, being careful in schools. We had a steady decrease, and that was really good news. I think about the high mortality we had, the high number of deaths, especially among the older population. That too startlingly came down. In May and early June of 2021, we had maybe fewer than 100 cases per day at that time. I mean, it was really amazing what had happened. Unfortunately, with the arrival of the Delta variant, which is more contagious, it spreads more easily. But also, I think with people being a little bit more complacent, being a little bit more lax, feeling like, we're COVID, we can put it behind us. We had a surge starting in July. And I'll tell you, that surge in July and August was every bit as high as the January surge. It wasn't just, oh yeah, we had a surge in last July as well. No. This was very different. This was as high in the number of cases per day as the January surge. Now, in the past several weeks, we've had a decrease. Now, we're still having over 1,500 new cases a day, but we had been as high as over 5,000 new cases a day. So we've definitely come down, and hopefully that trend will continue. I'm still a little bit concerned about kids in schools. We don't have a vaccine for kids under age 12 yet, and kids 12 and up can be vaccinated. There is vaccine available for them, but we only have about 30% of our adolescents aged 12 through 19 vaccinated in South Carolina. So still pretty low level. So when I think about people are asking, can I get my family together for Thanksgiving? What about Christmas? What about travel? I think we still have to suggest the same cautions. You have time. If you're not vaccinated, you still have time to get fully vaccinated before Thanksgiving. And that would go a long way to protecting not just yourself. Who are you thinking about visiting for Thanksgiving? It might be your grandmother who, even if she's vaccinated, older people, vaccines don't produce as strong an immune response in older people. So when you're thinking about the holidays, make it part of your holiday planning to consider getting vaccinated. And we'll talk more about that on this show. But some of the other things apply too. Outdoors is always safer than indoors. If the weather is nice, you want to get together with family and friends. If you can do it outdoors, that is much safer. Same thing with going out to restaurants. It's, if they've got outdoor seating, it's safer. So much to talk about where we are. Where we are right now, yes, number of cases coming down, but we're a little bit worried about what's coming later on in the year. So the more we can get those numbers of vaccinations up, the better. We're sitting at a little bit more than 50% of people in South Carolina age 12 and up who are fully vaccinated. But I have a couple of pieces of really good news. One of them is that the Food and Drug Administration is going to be looking at vaccine for ages 5 through 11. Pfizer vaccine has applied for vaccine for that age group. And the results thus far look really good, that it's highly safe, that those kids did not have any more adverse reactions than older teenagers. So yeah, sore arm or feeling achy for a day or two, that's a sign that your immune system's getting revved up, that it's responding to the vaccine. But no more serious complications than that. And it was highly effective in preventing severe disease and preventing, in fact, any symptomatic illness at all in those kids. So that's really good news. We might have that vaccine available as early as Halloween.
Yeah, that is so important. I've been fortunate to be able to listen to a lot of folks from the children's hospitals in South Carolina, and the data and the reports that they give that this Delta surge has impacted kids and teenagers more adversely than normally we're expecting the older people to be adversely impacted. But this time it was kids and teenagers.
Yeah, this is scary. At first, we've known that the Delta variant is more contagious. We've known that for a long time, but it wasn't certain whether it causes more severe disease. Now, increasingly, it looks like it does cause more severe disease in adults, but also in children. We're seeing more cases of the multi-inflammatory syndrome of children. That is a condition from SARS-CoV-2, the virus, in which multiple different organ systems are attacked. For example, people talk about vaccine and the rare side effect of myocarditis or heart inflammation. That's really pretty rare. I mean, we're talking like 5 or 6 cases per 100,000 doses of vaccine, but for young adults. But in terms of MIS-C, almost 100% of these kids who get that inflammatory syndrome have myocarditis. And it's more severe. They get a bunch of other conditions. It's not just causing lung disease. I know this is a rare condition, but it's, most kids do not get seriously ill, but the ones who do sometimes die or are left with, severe complications that last a long time. So, I can't help but think this is a vaccine preventable disease. Even if it's just one child who dies, that's one child who didn't have to die. You could give them a vaccine to prevent the condition.
Absolutely. I was talking to Marek and Daniel earlier before we all got together, and I had heard an extremely heartbreaking case. Now, at first, I thought it was South Carolina, but it turns out it was in Mecklenburg County of a death of a 7-year-old.
Yeah.
And what's so heartbreaking about it was that 7-year-old was so vulnerable. They weren't eligible to get the vaccine, but all those around them that were not vaccinated,
Yeah.
it just was breaking my heart. I'm really excited about this potential of Pfizer for the 5 to 11-year-olds.
Well, you think about it, there have been over 200 million doses of Pfizer vaccine given in the United States. I don't mean COVID vaccines in general. I mean specifically Pfizer, more than 200 million doses. And really, there's been very little in the way of side effects from it. And when you think about the hundreds of thousands of lives it's probably saved, it's really awesome.
Really. It really
But I feel like here I don't want to be just sounding like a car salesman trying to tell you how good the vaccine is. I'm here to answer people's questions so that they can make their own decisions. And I know I mentioned the myocarditis question because I know that's a common one. And let me just return to that just to make sure that I'm clear. When you are vaccinated, and this is true with any vaccine, this is true when you get a tetanus shot, this is true when your baby gets their MMR. It revs up your immune system. What does that mean? Well, it means you might have fever for a day or so, feel achy all over, have a sore arm. That's because your immune system is responding. Part of that response is inflammation. That's why you have that soreness in your arm. It's inflammation in that area. Other vaccines can cause inflammation of multiple systems, including inflammation of the heart muscle. Now, I know that sounds absolutely terrifying, but I'm here to say that there are a lot of different causes for myocarditis, and they're not all the same. For example, you can get myocarditis as a side effect from certain medications or from autoimmune diseases like lupus. Those cause serious problems. That can be severe. The myocarditis that is being seen associated with the vaccine has been mild. And I'm not saying that just from the CDC data. In fact, Kaiser Permanente, which is a big HMO in California, they just recently published their data on myocarditis. Now, they have vaccinated more than 2 million people in their system, and they found 15 cases of myocarditis and looked at those 15 cases. They were all among men. They were all under age 40, but they were all mild. They were hospitalized for a day or two because they want to watch their heart rhythms to make sure that they're not having any irregular beats, but they were all discharged and they're all doing fine. That's one example. Israel is also following myocarditis cases. Israel is using the Pfizer vaccine, and they too are finding some cases of myocarditis. It's a little bit higher among younger people and higher among males versus females. But again, we're talking about 10, 15 cases per million doses of vaccine. It's a really rare occurrence and something that is highly treatable. So each of us has to make a risk benefit decision, right? About whether to get vaccinated, whether you want your teenager to get vaccinated, whether you want your child to get vaccinated. So when we talk about the risks of the vaccine, that's one of them. But you have to also think about what's the risk of not getting vaccinated. The risk of not getting vaccinated is getting COVID-19. And it's true, young people, they're less likely to have severe disease, but that number is not zero. There have been zero deaths from myocarditis. There have not been zero deaths among young adults from COVID-19. I mean, we've had kids from age, under a year of age to through age 20 who have died of COVID-19 right here in South Carolina. I'm not talking big numbers nationally, I'm talking here in South Carolina. So I think that's where people have to weigh what do you know about vaccine? What do you know about COVID?
You know, we've watched a couple of young people, both in our church and at CareSouth, who were early on infected with COVID, but now have long haul COVID that's going on and on and on. We don't know what this disease is doing for the next year or 18 months or what have you. That is terrifying.
That is a real phenomenon, long COVID. In the very beginning, there was questions about it, is this real or not? It's definitely real, and it is accepted around the world. Studies are going on right now to try and figure out what is happening. It's thought maybe it's an autoimmune response where you make antibodies to your own tissue, as like an over response to having had that virus infection. There have been some reports of people who had long COVID whose symptoms improved after they got vaccinated. That's not proven yet, that they're anecdotal, they're case reports. But there is consideration that if you had COVID before, you would still benefit from getting vaccinated, benefit with a relief of your long COVID symptoms, but also benefit in decreasing your chances of reinfection. And that's not just in theory. Again, I can give you some studies. Israel was one of the first countries out of the gate with vaccinating people, and they rapidly vaccinated almost their entire population. And they have been studying reinfection. And the Israel studies have made it clear that people who had COVID infection and then got vaccinated afterwards doubled their protection against reinfection. We've got some studies here in the States looking at that as well, in Kentucky and LA County, Los Angeles County. But, Israel has more than 5 million people vaccinated. So they've got the numbers to look at reinfection. That's pretty convincing that getting vaccinated will decrease your chance of reinfection.
Wow. 5 million?
Mm-hmm.
That's a lot of people.
That is a perfect segue
Yeah.
to the booster, because I don't want to go out and get infected just to boost my immune system. But there are boosters and the third shot.
All right. So this is more confusing than it needs to be. So let's separate those two things apart from one another. What is the deal with a third shot? And why do I call it that instead of a booster? People who are immunocompromised, and by that I mean people who, for example, had an organ transplant. Let's say they had a kidney transplant, and now they have to take medications to prevent them from rejecting that transplant, rejecting that graft. They are immunocompromised. They are deliberately taking medications that suppress their immune system. So what happens when they get vaccinated? Well, they don't get as strong an immune response. They get some, but not as strong an immune response. So instead of giving them just 2 doses of the Pfizer or Moderna vaccine, it's recommended that we give them 3 doses, just because they didn't have as strong a response to the first 2. And they should get that 3rd dose as soon as possible, as long as it's been 28 days since their 2nd dose. And that's true for people who got Pfizer or Moderna if they're immunocompromised. Now, what about everybody else? Everybody else can or doesn't have to get a booster. By that, I mean a booster is a dose of vaccine that you give after the primary series. So you get your first 2 shots, and then you wait a certain period of time, and then you get a booster dose to kind of remind your immune system about this virus and how to respond to it. And we use boosters all the time in medicine. That the fact that there's a recommended booster dose doesn't mean the vaccine doesn't work. I mean, think about, you get a tetanus booster once every 10 years. Think about, all those pediatric vaccines. You get your measles shot and then you get a booster at age 4 to 6 years. Or what about the diphtheria, tetanus, pertussis shot? Kids get a dose of that at 2, 4, and 6 months. Then they get another booster when they're a year old. Then they get a second booster when they're 4 to 5 years old. So they actually get 5 of those shots to make sure that their immune system remembers. Same deal here, that after a certain period of time, you want to give a booster so that you can make that immune system memory last longer. Now, what have we learned? Again, I'm going to talk about Israel as well as studies in the United States, because Israel has been vaccinating longer than most countries, longer than we have, for example. So they're a little ahead of the game. We can look at their data and say, that's information we can use. So for example, Israel started vaccinating people August 1st, people who were age 60 and older. And what they found was as soon as 2 weeks after that booster, that the reinfection rate dropped in that age group. Older adults don't have as strong an immune response in general. And so what is recommended in Israel and recommended now in the United States is if you're age 65 or older in the US and you got the Pfizer vaccine, you should get your booster if it has been 6 months after your second dose. Why 6 months? Because that's the optimal timing. So for me, I got my second dose of Pfizer in April. So May, June, July, August, September, this month, I'm going to get my booster dose. Now, why didn't I get it even earlier? Because I want the biggest bang for my buck. I want that shot to give me the optimal immune response. And that has been, they've shown it in Israel and they're showing it in studies in the United States. That would be at 6 months. So no earlier than 6 months. What about the people who got Moderna and Janssen or the Johnson & Johnson vaccine? Well, it's recommended that you don't mix and match your vaccines. And in fact, next week, FDA is reviewing the data on the Moderna booster and a second dose of the Janssen vaccine. So, hang on, let's wait another week, see what they have to say so you don't mix and match your vaccines. Now, I mentioned age 65 and older, definitely should get a booster. What about other people? Well, if you're 50 to 64, and you have medical conditions that put you at increased risk of severe COVID, like diabetes or heart or lung, kidney disease, or even if you're just overweight or obese, those all place you at increased risk of severe disease. So again, it's recommended you get your booster. What if you're under 50? What if you're between 18 and 50 and you have those medical conditions? Then it's kind of your choice. You have to weigh for yourself your risks and benefits. What are the risks of this booster shot? Well, from what they saw in the studies, there weren't really any more increased symptoms from getting the third dose compared to getting the second dose. So think about, how did you feel after your second dose? For me, it wasn't that big a deal. I had a sore arm. That's about it. But I know other people have more symptoms. The symptoms that you could expect after a third dose, the booster dose, going to be about the same as what you experienced with your second dose. Each one of us has to think, how likely am I to be exposed to COVID-19? Do I have a job where I just telework and I don't see anybody? Or do I have a job where I'm out there in the public? Or do I do things that put me out there in the public, like going to restaurants, going to concerts? Am I starting, to return to normal life, going to school, in a work setting or, a social setting where you're exposed to other people? And then you have to ask yourself the question, if you got COVID, if you got SARS-CoV-2 virus, if you got COVID disease, how sick would you be? Do you have those other medical conditions? And then make your decision. One last category, and that's people who maybe are young and healthy. They've got no medical problems, but they know they're going to get exposed a lot. They're a worker in a healthcare setting. They're a teacher, elementary school teacher, exposed to kids who can't be vaccinated, who, are always having runny noses. What's your risk of exposure to COVID-19? Those are people who, if they want to get the booster, they may get the booster. So basically, anyone age, right now, the booster dose is for, sorry, I had to pause. The booster dose is approved for age 18 and up. So right now, anybody 18 or up can get the booster. Highly recommended for over 65 and for people over 50 with medical conditions. Everybody else, it's your own individual decision. We know some employers are requiring it. Employers are requiring because it's the best way for them to keep their other employees as well as the vaccinated employees safe and their customers safe.
So, in the spirit of full disclosure, I've had my booster. I know. High five, Daniel. And it's the same story. I did not experience anything. I didn't even have a sore arm. Sometimes I think the nurse is a very good vaccinator, but I didn't even have a sore arm. So, y'all come on and join me.
Yeah.
I said boosters for 18 and up. They're not talking about boosters for teenagers yet. They're gathering information. Do teenagers really need a booster? They have such a good response to the vaccine. They might not need a booster, or they might not need a booster until next year. So we're waiting to see what the studies show.
I took Janssen, and so I'm hopeful they have that second shot booster that's going to be that they're studying now. So we'll see.
I've seen the preliminary data, so it's not published yet, but I've talked to Janssen about what did they find with the second dose. And with the second dose, they found that the effectiveness of the vaccine went up to 94%. Which puts it on a par with the Pfizer and Moderna, which is kind of what you would expect. I mean, they were trying to shoot for, let's do a vaccine that you just need one and done. And it's very good for keeping you out of the hospital, out of the morgue, keeping you safe from severe disease. But I know some people were concerned that, it doesn't seem to be as effective as the other ones. Did I get the wrong vaccine? It was very effective for a single dose, but it is reassuring to hear you get that second dose, you're getting as high an effectiveness as any of the others.
Absolutely. Yeah. Well, I'm excited. I can't wait. I'm glad they submitted that information and they're looking at it this way. I'm excited to be able to get that second dose. And I read that 94% too.
Yeah.
So I was like, oh yes.
Well, I'm going to take mine as often as they say we need it, every recommendation that come up, because I want to make sure that I'm still here, make sure that everybody around me is still here. And so that segues to the other question that we got. So I'm not in this category anymore because my kids are grown and I'm not going to start over. My oldest is in college, my youngest is in college, and I don't want to start again. But suppose I want to start a family. How are these vaccines going to affect me and my reproducing or increasing my family? Is there any?
And I know this is a question in the foremost of many people's minds, young people's minds. So let me separate out male and female fertility and talk about both these, because we do have, in the very beginning, of course, nobody would really know, right? They don't do vaccine studies on pregnant women, and it would take time for any fertility information to emerge. But now there is information both for males and females. Let me talk about males first. I don't know how many people know this, that mumps is a virus that causes not just swelling in your salivary glands. Mumps actually causes swelling in the testicles. Mumps can actually cause infertility. That virus, sorry guys, guys are looking horrified, but it's true. Mumps can cause swelling and an inflammation that leads to scarring and infertility. So the mumps vaccine for men, in fact, helps to preserve fertility. There is some evidence, now it's not a lot, but there is some evidence that people who get severe COVID, I'm not talking about mild COVID, I'm talking about people who have severe COVID, that they get inflammation, not just like the myocarditis I mentioned. It can affect any organ system and can also give you that same inflammation in the gonads, in the genitals. It's called, the medical term is orchitis, causes an inflammation, and there is some evidence for decreased sperm counts, decreased sperm motility and quality. There is some evidence that COVID disease, and I don't mean mild or asymptomatic, I mean more serious disease, can affect male fertility. On the flip side, there has been no evidence of vaccine affecting male fertility. Now, how can I say that? Because they have done studies where they've looked specifically at sperm counts. And that when you do a sperm count, they're looking at sperm quality, meaning how well they're moving, the sperm count, how many million per cc of semen, looking at other aspects. There has been no evidence for a decrease in male fertility looking at sperm counts. Female fertility is more complicated. We all knew that, didn't we? That women are going to be more complicated. But let me not make a joke. Let's talk about this quite seriously. So vaccine was not studied in pregnant women, but when the vaccine became available, there was no reason to think women could not take this vaccine. There was no reason to think it wasn't safe in pregnancy. How do I say that? Well, we give other vaccines to pregnant women. Vaccines like tetanus shots, flu vaccine, Pneumovax. The trick is you don't want to give a pregnant woman what's called a live virus vaccine. That's different because that virus, for example, yellow fever vaccine, can cross the placenta and affect the baby. None of these COVID vaccines are live virus vaccines. In fact, they don't have virus in them at all. They do not have whole virus or killed or weakened virus. All they have is the gene for one protein in that virus. So they cannot cause COVID disease, and they cannot cross the placenta to affect the developing baby. But we've got more than just theory. We have data now. Over 35,000 women who were already pregnant when they got vaccinated or got pregnant shortly after they got vaccinated. Over 35,000 women have been followed by the CDC through their pregnancy to look and see, did those vaccinated women, did they have any increase of bad outcomes? Did they have preterm labor, or did they have, a miscarriage? And the answer is no, they did not have an increase in any of those events compared to in general with unvaccinated women. Unfortunately, a certain percentage of pregnancies naturally do end in miscarriage or stillbirth, but the rate of that is no higher among vaccinated women than unvaccinated women. No increase in miscarriage. You would think if the vaccine caused problems with fertility, it would be by attacking the placenta. No evidence for that. But I've got two other bits of information that I think are really pretty interesting. Did you know that the rate of unintended pregnancy among vaccinated women is the same as unvaccinated women? These were unplanned pregnancies, not women trying to get pregnant, but it was the same rate whether you were vaccinated or not. And recently there was a study published by some fertility clinics. So these are people who have pre-existing fertility problems or go into a fertility clinic where they do what's called in vitro fertilization and then, implant the embryo in the womb, in the uterus. The rate of success of that procedure is the same among vaccinated women and unvaccinated women. So I feel like we've got three paths of excellent information, knowing there's no increase in stillbirth or miscarriage, that unplanned pregnancies happen just as frequently, whether you're vaccinated or not, and that even in the highest risk group, people who have fertility problems, they're able to keep their embryo and grow it into a healthy baby at the same rate as people who are not vaccinated.
Well, you know, Dr. Kelly, there's a young lady that I know. She said she's in high school and she's at the age where she can be vaccinated. And she was on the schedule to get vaccinated and came to me and said, they call me Sean in the community. That's my middle name. They call me by my middle name. They said, Mr. Sean, I was supposed to come get my vaccine, but I changed my mind because the school nurse told me not to take it if I want to have kids.
Oh
So
no.
so this podcast is evidence that I can take back to her that she can hear it from somebody who's way more, competent. And I'm not saying that nurse is incompetent, but has more experience and has more evidence-based information to give other than personal information. And
Well,
maybe she
and
can get a vaccine.
And, it may be the nurses dealing with old information. I mean, think about what's my job. My job is to try and read all these scientific studies and then bring that information to people. That 35,000 pregnant woman study I mentioned, that was only published in June of 2021. And those other two that I mentioned, I just read them yesterday. So these are new studies. As new information comes out, we just need to make sure it gets to the people who needs it. Sorry to hear that nurse didn't realize those new studies, but of course she's busy with other things. It's my job to try and get the word out, and I'm glad this is one way we can do that. All work together to do that.
And that's why we love. Well, that's why we love the podcast so much, because it give that information that we need to get out to the public in the mass, where we don't have to individually say it, but we have evidence where somebody with that experience is talking to you, personally, on a personal level about your concerns, so that we can get these things addressed and we can have more vaccination, compliance. And we're hoping that this, we trust that this is going to really work.
Well, the other challenge is that, we're social creatures, and, one story seems to, trump everything else. So you'll hear one story about some unfortunate woman who was pregnant, got vaccinated, and had a miscarriage, because it's going to happen.
Yeah.
Just like it will happen to women who don't get vaccinated and have a miscarriage. And the thing to look at is you have to look at numbers of people over time and compare, was there more miscarriages among people who got vaccinated? And the answer is no. That's where we have to look at thousands of people. The other thing is people share their stories, their personal anecdotes, and the one that I think that gets shared, especially among teenage girls or young women, is the vaccine is going to mess with my period. Right. And there is evidence. There is some evidence that the vaccine can temporarily change your menstrual period. But think about, women out there listening to this, think about all the things that can affect your menstrual period, right? Mm-hmm. Emotional stress, physical stress, fever, travel, change in schedule. There's so many things that can affect your period. I'm not at all surprised to hear that you give me a vaccine that makes me feel achy all over, that might give me fever, that revs up all these different organs responding with an immune response. Mm-hmm. I'm not surprised it might change my upcoming period, but it shouldn't be persistent. So I do want to get that message out to people that if you have been vaccinated and your periods are abnormal for 1 month, okay, might be from the vaccine, might not. But if it persists in being abnormal, you really should see your healthcare provider and find out there might be something else going on, an infection or a hormone imbalance. It's worth seeing someone to get tested. But the other thing that I hear people talk about is, women who are young woman gets vaccinated, messes up her period, and messes up the periods of the girls around her. Is that true? I want to remind you of a very interesting study that was done years ago. Women living in college dorms synchronize their menstrual periods. Nobody knows how this happens. Nobody knows whether it's pheromones, hormones, but they tend, after they've been living in close proximity for a time, they start to get their periods synchronizing at the same time. Wow. So, menstrual periods and fertility, they just feel like these big mysteries, but there is science looking at these things as well. So I'm not surprised if getting a dose of vaccine messes up a period. And changes some, periods of women around them. This is not unique to COVID vaccine. This is a common phenomenon of women living closely together, that they synchronize their periods. But now I feel like we're going far astray.
It's all education.
That's fine. There'll be people. There is something that I do want to talk about, and that's the flu vaccine and the COVID vaccine. It's that time of year, and I've gotten a lot of questions about this. Can we have them at the same time? Isn't it too early to get the flu vaccine? I've had a lot of questions around this, so help us understand.
The best time to get the flu vaccine is before the end of October. So, here we are. It's October. You can get your flu vaccine now. You definitely want to get it before the end of October. You can get the flu vaccine and the COVID vaccine at the same time. It's recommended you get them in different arms just to decrease soreness, but you do not need to space them out. In the very beginning of the COVID vaccines, we were spacing them out because we didn't know as much about the vaccinations. But now, with more than almost 400 million doses of COVID vaccine has been given in this country, we've learned a lot. You don't need to space them out. You can get your flu shot and your COVID booster same time.
What about the pneumococcal?
Pneumococcus, the pneumonia vaccine. Yes, same thing. You do not need to space out your COVID vaccine from pneumovax, tetanus, pediatric vaccines. Kids going to college needs the meningitis vaccine or HPV vaccine. You do not need to separate them from the COVID vaccine. And similarly, if you're over age 50, you're eligible for the pneumovax, the pneumococcal vaccine. So, excuse me, for the Shingrix vaccine. Sorry. If you're over 50, you're eligible for the shingles vaccine. If you're over 65, you're eligible for the pneumovax vaccine. And I get all of these vaccines. I have been fortunate to have lived a pretty healthy life, but I think I can attribute a lot of that to the vaccines that I've had.
Okay.
Absolutely. At CareSouth, the flu vaccine has been a healthcare requirement for employment. Maybe 3 or 4 years now. I can't remember. And it has really made a difference. Before we did that, there were times during flu seasons where we almost had to close offices down because there were so many staff with flu. And just think about what we were doing to our patients. So we are right now in the midst of going around and getting our employees vaccinated for the flu.
Yeah. And the flu is not just for older adults or adults in general. There's a flu vaccine for everybody. There's a flu vaccine for pregnant women. There's a flu vaccine for kids as young as 6 months of age. There's a flu vaccine that's a nasal spray. So that, you're afraid of needles, you can get a nasal spray vaccine. And, we are a little concerned that we really have not had much of a flu year this past year or the year before. We've had 2 years in a row where not very many people got the flu. That's good, but that means that many more people susceptible this year, that they've not been exposed to flu viruses. That includes the kids. And the kids can get pretty serious infections with influenza. So we encourage everybody age 6 months and up to get their flu shot.
Absolutely. Okay, Doc. So before we close out, could you touch on monoclonal antibody treatment before we close out? Still there's still questions out there. What is it? How is it done? Is there one or two methods? Is there there's IV the only method? Did you touch on that before we?
Absolutely. Thanks for bringing that up. So when you get vaccinated, your body makes natural antibodies, makes your own antibodies, and not just antibodies. It also stimulates things called B and T cells. These are memory cells. They remember the virus for years, literally, so that, if you get infected, they can step up to the plate and make you a bunch of antibodies again. But if you got COVID-19 and you're in one of those risk categories, let's say that you have diabetes or, you have some other medical condition that puts you at increased risk, even if you've already been vaccinated, but you're worried you're not going to get as good enough response because of your medical conditions, you can get what are called monoclonal antibodies. These are passive antibodies. These are antibodies that are made in a laboratory and then put into an IV, so they can start an IV, give you an infusion of the antibodies, or in some cases, they can give it to you as a series of subcutaneous shots. Those are shots under the skin with these passive antibodies. Those antibodies are temporary, so they're not going to last forever. They'll last about 90 days, but those temporary antibodies will help your natural immunity, give you a little bit extra to try and prevent you from progressing to severe disease. And they're very effective. They've been shown to reduce hospitalizations by as much as 70%. So if you test positive for COVID-19, you test positive, contact your healthcare provider and talk about whether monoclonal antibodies, passive antibodies, would be good for you. Because there are some specific criteria. You have to be at least 12 years of age or older, weigh at least 88 pounds. It's recommended for some people, not so recommended necessarily for others, but most people would qualify. The monoclonal antibodies are free. The administrative costs, like of starting an IV, they're covered by insurance or covered by HRSA if you don't have insurance. But I think a lot of people don't know about them. So we want to make sure, get the word out. If you or someone you know tests positive, ask whether you ought to get these antibodies.
And at CareSouth, we do them over in Hartsville. We can do the assessment on site. Our provider there can assess whether the individual is eligible. So we really need to use this as another tool in our tool belt, this monoclonal antibody. Now, there will be some other tools coming. We hear that there is an oral antiviral that may be coming before Christmas or Thanksgiving, but this is what we've got now. We've got vaccination, masking, and now the monoclonal antibody.
And as good as monoclonal antibodies are, I do want to stress they are not a substitute for vaccination. The best protection is to go ahead and get vaccinated. And then if you happen to be the rare breakthrough case, monoclonal antibodies will still be there for you. But don't rely on them if you're unvaccinated. Nobody really knows if you had to get them again and again. No one really knows whether that might have some bad effects. So, we know single dose of monoclonal antibodies, highly safe and effective. But you don't want to rely on it and feel like you might need to get it again and again. Much better to get vaccinated because those monoclonal antibodies will be there if you're the rare breakthrough case.
Absolutely. Well, thank you. Thank you. As always, a wealth of information. Great information. We thank you for coming to join us today on the CareSouth Carolina Community Live podcast. Thank you, Ann, for joining us as well. We appreciate it. We always love to get that information out any opportunity we can so folks can be informed, so they can make that decision. We still have a lot of people that's trying to make up their mind. You have some that's dead, they're dug in, but you have a lot of people that are still trying to make their mind up, and we hope this helps, and also provide information on where you can come get help and come get the vaccine if you need it. Our schedule is posted. Our Moby schedules are posted on our calendars on our website at www.caresouth-carolina.com. You can check our Facebook page as well, our Twitter page. And let me mention too, I tried something different today. I didn't tell anyone, but we're now projecting this podcast on Twitter, CareSouth Carolina Twitter page. Yeah. So we're on Facebook, we're on YouTube, and now we're on Twitter. So yeah. So I was checking it during the broadcast and everything was looking good. So again, Doc, thank you. And we definitely appreciate you being here. And if anyone wanted to get contact with us again, you can check us out on our Facebook page at caresouth-carolina.com. And Doc, if they want information about COVID, and also they can check the DHEC page. And what is that?
So the DHEC page is dhec.sc.gov. So you can also just Google COVID DHEC and it'll bring you to our webpage. So you don't have to remember the webpage. And, the CDC is also a big source of information, but I know some people don't really like going to government websites and they're not as keen to look at CDC or DHEC's website. So I've got some other recommendations. If you're looking for information, don't rely just on what you may hear in social media or even a podcast like this. Seek out some additional information but seek it out from credible sources. What are other credible sources? Well, think about all those academic centers, all those universities that have schools of public health. So, for example, I would think about Emory or Harvard or the School of Public Health in UCLA or UC San Francisco. But another source is also Morehouse. Morehouse has a School of Medicine, and they have an FAQ page on COVID. So, that's another credible source if you're looking for some information, is to look at Morehouse School of Medicine.
Wow.
Thank you so much. Dan, you have any parting words before we leave?
No, like I said before, once again, we always want to bring you evidence-based information, and we don't want to ever bring you any ignorance-based information. We want everything that we bring to you to be factual, to come from experts, and come from people with knowledge of what we're talking about. Every now and then, me and my rec may give our opinion, but it's just that, our opinion. But we have people here with factual information to give you the correct information so you can make an informed and educated decision about your health.
And you want to close us out?
I can. I have done a deep dive into COVID, it seems like, for the last 18 months. But I learn something every single time that I hear all of this information. And I those two studies that just recently got published yesterday, that was fresh information. So we've still got a lot to learn, but what an opportunity. So thank you, Dr. Kelly. Thank you, Marek and Daniel, for doing this platform. Y'all are amazing. Thanks for the opportunity.
Absolutely.
Thanks to you guys for getting the word out.
Oh, yeah. Oh, yes.
Absolutely.
All right.